Hi, I'm Dr. Sandeep Jha. I'm a liver disease specialist and a liver transplant surgeon, and I work as a consultant at Manipal Hospital, which is in Dwarka, Delhi, India. Today, I'm going to discuss a few myths that are associated with fatty liver disease, and I'm going to keep my answers short and crisp so that I can cover most of the myths that I come across. If you want more information on these topics, you can watch my earlier videos on fatty liver disease. So, the most common myth that I come across is that fatty liver is nothing to worry about and patients are not concerned about it. However, if you look at the data on fatty liver, around 5 to 10% of patients might have chronic liver disease and cirrhosis, and the same fatty liver progresses to end-stage liver disease, and then it can be life-threatening condition. So if you are diagnosed with fatty liver, you should consider it an opportunity to get further investigated and assess the amount of damage to the liver. So it is enough to worry about, so that you can get further investigated and then take care of your liver so that you can preserve it for longer and live longer. So another common myth that I come across is that it only happens in people who are taking alcohol. No, not true at all. While people who take alcohol have higher predisposition to alcoholic liver disease or liver damage, fatty liver can be seen in people who do not take alcohol also. And if there are predisposing conditions like diabetes or dyslipidemia or obesity that are present in individuals, then they are also predisposed to developing fatty liver disease and chronic liver disease. So this myth is not true at all. A myth that I come across very frequently is that hard liquor is worse than beer or wine. Not true at all. The actual damage to the liver is due to the ethyl alcohol content or ethanol content in these drinks. And all these drinks, may be hard liquor or beer or wine, have some amount of ethanol or ethyl alcohol in varying proportions. So it is the cumulative intake of ethanol or ethyl alcohol that is actually damaging your liver, and it is present in varying proportion in all these drinks, maybe beer, wine or hard liquor. So you have to be mindful of this fact. Fatty liver is a rare condition is a myth that I come across very frequently. Not true at all. Fatty liver is present in 20 to 40% of the population, and this data is emerging from most of the countries across the world. And right now, immense amount of research is going on about fatty liver and non-alcoholic fatty liver disease and non-alcoholic steatohepatitis, and it is slowly becoming the leading cause of chronic liver disease and cirrhosis, and would soon become the leading cause of liver transplant in many countries across the globe. So no, fatty liver is not a rare condition. Another myth that I come across is that fatty liver only affects fat or obese people. No, not true at all. Obviously, obese and fat people have higher risk of fatty liver disease, but fatty liver disease can develop in non-obese individuals also. If they have causative factors like diabetes, dyslipidemia, alcohol intake or other rare causes of fatty liver, they can very well develop fatty liver, and they should be mindful of the fact that they can develop fatty liver even if they are non-obese. A common myth that I come across is that it does not affect children. No, not true at all. Children can also be affected, but much lesser proportion than adults. However, if predisposing factors like diabetes and obesity and dyslipidemia and other causes are present in children, they can very well develop fatty liver over next 5 to 10 years. Another common myth that I come across is that people are scared that there's no other treatment for fatty liver other than liver transplant. No, not true at all. Fatty liver is a very eminently reversible condition, and if it is diagnosed in a timely fashion and right management is done, then fatty liver can be reversed and liver can be salvaged. However, liver transplant is a treatment for end-stage liver disease or decompensated cirrhosis when the liver disease has completely gone out of hand, and such a condition will not arise if the fatty liver is diagnosed early and right management is done in a timely fashion. Another common myth is that women are more likely to develop fatty liver. No, not true at all. Global data shows that men develop fatty liver and NAFLD and NASH more commonly than women do. In fact, it is thought that women are protected because of higher levels of estrogen in their blood in the premenopausal stage. Another common myth that I come across is, doc, I drink under permissible limits, so I cannot develop fatty liver. No, 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 not true at all. Although in books, in media, in the internet and all other information channels, we come across figures or tables that say that this is the permissible limits for men and women, and usually it is quoted like 2 drinks a day for men and 1 drink per day for women is permissible limit, and that these people will not develop any liver damage. However, in our clinical practice, we frequently come across people who drink much less than the permissible limit and still develop chronic liver disease and cirrhosis. So you should not be misled by the fact that since you drink under permissible limits, then you cannot develop a problem due to the alcohol. So if you get an opportunity, you should get investigated for fatty liver, especially if you drink alcohol, no matter how much amount. Another very common misconception or myth that I come across is that, doc, I have virtually eliminated fat from my diet, so I cannot get fatty liver. No, not true at all, because the fat that is deposited on the liver does not always come from the dietary intake of fat. It is a high carbohydrate diet which is rich in sugar, fructose, refined sugar, table sugar and other kind of sugars that are present in our daily diet. These high carbohydrate diet get converted into fats and lipids, and that gets subsequently deposited on the liver and then damages the liver. So it is not only the fat, even the carbohydrate can get converted and cause fatty liver disease. So do not be misled by the fact that you have reduced or eliminated fat from your diet so you cannot get fatty liver. That is a misconception. So thank you. If you think there was beneficial information and you got good information from this video, then please like, share and subscribe this video so that more and more people can benefit from this information. Thank you.